About 1.6 million people worldwide currently suffer from a nosocomial infection. In developed countries, between 5 and 10% of inpatients develop an infection while being treated in a hospital. This can reach up to 25% in poor or developing countries. There are many causes of infection, including the lack of hand hygiene. We're here in Phnom Penh, the capital of Cambodia, located in the heart of Southeast Asia. In August 2014, the Cambodian government committed itself to the World Health Organization's campaign promoting hand hygiene in hospitals.
Promote the hygiene and the sanitation and prevention measure in the hospital. That's very important. We use some some tool or some activity related to infection control, like hand washing, hand washing. The others you see that is sanitation related to the control of the infection in the hospital.
With 15 million people, Cambodia is the 134th country to join the WHO campaign launched in 2005.
It's clear that this is a very critical time for the government to decide and to recognize that infections exist in hospitals. Remember that there are still many countries around the world where officially there is no hospital infection.
Clean Care is Safer Care is a universal WHO campaign based on creating practical and educational tools to enable health professionals to promote and implement hand hygiene in practice. In 2012, the WHO created the POPs, which stands for Private Organizations for Patient Safety. This is an exchange and knowledge-sharing platform for private organizations and companies specializing in patient safety.
I think Didier has been successful to make 150 countries now, but there are still some. And Cambodia was one of them. They signed today. I think each hospital needs some support from the government, So it's a kind of joint project with the government, NGOs, or local, and also the hospitals and WHO.
In Cambodia, Saraya teams assisted several hospitals in the capital 6 months before signing the WHO Convention pledge. Visits, education and training were essential components of the assistance provided by Saraya teams. Professor Didier Pittet is very well known in the four corners of the world as he travels around promoting hand hygiene in healthcare facilities to encourage medical teams and foster their creativity and enthusiasm.
There are different possibilities. Either the government will allocate some resources with a team to say, okay, why don't we embark in a national campaign, or the government will sort of help a hospital or another structure to further develop the concept according to the WHO initiative, or individuals or single hospitals will be leading so well that they could lead other hospitals in the country, and then the Ministry of Health could simply say, why don't you follow this example? So anyway, the pledge is always important.
It's a kind of long-term asset investment that we came together with the Ministry of Health, and also we should be competitive in providing affordable product to them, to provide some educations through the business process. But I think this is a kind of new approach, and I hope this will be a very successful.